Good morning. Come in, please.
Thank you.
Have a seat. My name is Yamile Carrasana. I'm the nurse practitioner to assess you today. Your name is?
Alejandro Martinez.
Your date of birth?
It's January 16, 1988.
Okay, Mr. Martinez, what are you here in today?
I'm here for a physical examination.
Okay, nice for you. We're gonna check head to toe to see if something is coming abnormal or if everything is fine for your new job. Now we're gonna provide privacy to the patient, dress the patient properly for the physical examination. Okay, Mr. Alejandro, right now I'm gonna check your vitals, blood pressure, respiration, heart rate, and pulse. Sometimes we can use gloves independently of the situation. In this case, patient is coming for a physical examination pre-employment. Looks like the patient is totally healthy. Then we're gonna avoid to use glove. Okay, Mr. Martinez, I'm going to check your vitals. Okay, your blood pressure is 120/85. It's normal for your age. Let me check your pulse. Okay, you have a pulse of 80 per minute, 80 pulsation per minute, and your respiration is around 16 per minute too. Okay, do you have any medical condition?
No, not that I know.
Are you taking any kind of medication?
No.
Do you have any allergy?
Yes, penicillin.
Penicillin. Okay, perfect. Then we're gonna start to check system by system, head to toe, little by little. Okay? Mr. Martinez, I'm going to start your physical examination by your head, your skull, scalp, and hair. Perfect. Okay, now I'm going to continue examination on your face. Let me look at your face. This is your checking your artery, temporary artery. I'm gonna check your temporomandibular joint. Do you mind to open your, okay, close, open, close, perfect. Now, I'm going to check your ears. We have to use the otoscope to check your external auricular canal and your membrane. Everything is normal, no circulation. Your tympanic membrane is pale gray. Do you have pain?
No.
Okay. No abnormal bumps, no scoriation. Your ears are symmetric. Okay, Mr. Martinez, could you please occlude your ear with your right hand, your right ear? I'm going to whisper some words to see how acuity is your ear. Okay, go ahead. Cuba, can you hear me? What I
Yes.
say?
Yes.
What I say?
Cuba.
Perfect. Could you please change now, occlude your left ear with your left hand?
Okay.
Cuba, do you hear me?
Yes.
What I say?
Cuba.
Perfect. Okay, Mr. Martinez, now I'm gonna check the waiver test. Is to check the bone and air conduction. This with using the tuning fork. We activate the tuning fork. We're gonna put the tuning fork in the middle of your head. You have to tell me as soon as you can not feel the vibration. Later, I'm gonna put the tuning fork in your mastoid and lay it close to your ear corner. Mr. Martinez, now I'm gonna check your vision. Checking your vision, we're going to check second cranial part, the optic nerve. At the same time, we're gonna check third, fourth, and sixth with the movement of your eyes and with the reflex of the light, the reaction of your pupils on the light. To check your vision, we're gonna use the Snellen chart. In this case, you're gonna close one eye on a distance of 20 feet to the Snellen chart. You must read the smaller letter you can see. We're gonna change position. You're gonna occlude the other eyes, and we're gonna do the same activity. Try to read the smaller letter you can see on a distance of 20 feet. Okay, Mr. Martinez, now I need you to try to read this sentence on this distance.
Course, description, and purpose.
Perfect. Okay, Mr. Martinez, now I'm gonna check your visual field by confrontation. Could you please cover your eyes with your right hand? Okay. Now I'm gonna move my left hand and you're gonna tell me as soon as you let to see the movement, okay?
Yes. Yes. Yes.
Now we're going to alternate hand, please.
Yes. No. Yes. Yes.
Okay. Okay, Mr. Martinez, I'm gonna check your eyes. Look at me, please. Look at up, down, this way, this way. Now, look at me, please. Look at me, look at me. Okay, with this examination, we can see patient has symmetric eyes, nice movement, symmetric movement, eyes browns in color, reactive to the light correctly, no secretion, no discharge, no bumps, everything is fine on his eyes. We can check internal eyes, darken the room using the ophthalmoscope. We're going to check with the right hand, the right eyes, to check internally the eyes. We're gonna check the orange reflex, the red reflex. We're gonna check the vascular distribution. So if the patient has some exudator inside the macula, the position of the macula, and if the patient has any abnormality on the eyes. We're going to repeat the action with the left hand on the left eyes. We're gonna check through the pupil. We're gonna check the retina, macula, vascular, and all kind of structure inside the eyes. Mr. Martinez, I'm going to check your nose. Look at me. Can you breathe? Can you breathe? Okay. Do you have any pain?
No.
Okay. At this moment, we can use the ophthalmoscope with a short speculum to check the internal nasal cavity. 1 hour at the time. We're gonna check for the septum, if any deviation, the mucus, the cornea, and if the patient has any abnormality. Mr. Martinez, to check your oral cavity, look at me, please. Smile. Open your mouth. Tilt your head. Put your tongue out. I can use the tongue depressor to see the tonsils, the uvula, the palatal, gum, teeth. Put your tongue out. Say out, out. Move your tongue to the right, to the left, up, down. Here we're gonna check the oral cavity. We check the oral cavity totally. Tonsils, uvula, pharynx, palatal, tongue, internal mucus, teeth, the movement of the tongue. Okay, now I'm gonna check your neck. Could you please look at this? This side. Okay. Move your head down, up, right side, left side. Okay. Lateralization. Right side, left side, now. Okay, perfect. I'm gonna check for any pain, bumps. I'm gonna check in nodes, periauricular, retroauricular, cervical, superficial and deep, submaxillar, submandibular. Do you mind to swallow? Okay. Thyroid. Swallow, please. Supraclavicular line. Deep cervical ganglion. Carotid. Pulse. One at a time. There is no bump, there is no pain, no abnormal nodes, inflammation, no rash, everything is symmetric. Movement of the neck is perfect. We examine the 11th cranial part. Continue examination of your neck. Could you please get a sip of water? Perfect. Okay. We examine the thyroid tracheus. The thyroid is not visible; it's palpable. We can palpate the thyroid from the in front position of the patient, or from the back of the patient with the position of the fingers one side, the other side of the neck. Now we're gonna check your chest, the symmetry, your respiration movement. Say 99.
99. 99. 99.
Okay. Perfect. Do you mind to breathe? The thoracic expansion is symmetric. Could you please lay down?
Okay.
Now I'm going to check your PMI, pulse, point of maximum impulse. Do you mind to turn over your left side? It's perfect. Okay, turn it around. Get sit, please. Okay, perfect. Now I'm going to perform the auscultation. Here I'm perform the auscultation of the heart rhythm. Is normal. I auscultate aortic, pulmonic, herb, tricuspid, mitral, and everything is fine. No murmur, no bruit. Using the bell of my stethoscope, I auscultate the carotid rhythm. There is no bruit. Everything is normal. Now I'm going to perform the respiratory auscultation. Deep breath, please. Deep breath. In and out. 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 Do you mind say 99?
99. 99. 99. 99.
Perfect. In and out. 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 Everything is normal. No adventitious sounds. Now I'm going to perform the percussion of the chest and the percussion on the upper back. At the same time, we can check the breast, male breast, if any abnormality is symmetric, both are symmetric, no abnormal bump mass visible, no collateral circulation. Percussion is normal. Could you please lay down? I'm going to examine your abdomen. Okay. On the inspection, I'm going to see if any abnormal bump, if any abnormal circulation, the color, the symmetry. Now I'm going to auscultate the patient sound, the bowel sounds. In some case that I can hear the sounds, I have to wait at least 5 minutes. We're going to start for the right lower quadrant. The vowel sounds are present and strong. Now I'm going to percuss the abdomen. Percussion is normal. Now I'm going to palpate first superficial, later deep. Any pain?
No.
We can perform by manual palpation, looking for organomegaly. Here we can perform a maneuver to check the if any pain. Do you mind to deep breathe? Okay. Here we're going to inspect the liver side. The spleen side is not palpable. And the descending column. Sigmoid. Okay. Now we're gonna check the kidneys by manual. Any pain?
No.
In some patients you can check, you can feel the right kidney. Do you mind to sit, please? Okay, we're gonna check the costo-vestibular reaction. Any pain?
No.
Mr. Martinez, I'm going to check your musculoskeletal system. Could you please try to move up your shoulders? Perfect. Again. Perfect. Move your head on this side. Perfect. This side. Perfect. Up. Down. This side. This one. Okay. Extend your arms. Up your arms. In front. Bend your arms. Okay. Your legs, please. Extend your legs. Okay. Laying down, please. Okay. Okay. With this leg, you're gonna put your heels over here, and you're going to slide your leg until the end. Okay.
Okay.
Okay. Go now. Perfect. The other. Perfect. Okay. Could you please open your leg to this side? Perfect. This side. Perfect. Up your leg. Perfect. Up your leg. Perfect. Okay. Have a seat. Try to check this bicep reflex, tricep, we check the reflex, bicep, tricep, patellar, quadricep, Achilles. Now let me check your hands. No clubbing, no cyanosis. Okay, now put your hand here, and you're going to perform the supination, pronation, supination, pronation as fast as you can.
Okay.
Go. Perfect. Okay. Now, please stand up. Okay. Extend your arms. Close your eyes. Perfect. Now, turn your body this side, the other side. Perfect. Turn around, please. Put your head, your spine. Excuse me, I'm going to put up your chair. Any pain?
No.
Okay. We're gonna check your pulse. Popliteal. Tibial. Pedal. Here today we perform the physical examination of Mr. Martinez for a pre-employment. Shows he's totally fine, no abnormality like bumps, mass, or limitation of movement, no skin alteration. Patient is alert, is oriented by 4. Cooperation, nothing is abnormal. Was a good examination, and patient is ready to have the job. And remember, every time you're gonna examine the patient, you have to wash your hand before and after the examination.